This week we've had a lot of people come into the clinic with questions about acne. So we've asked our favourite clinical director, Dr. Sunil Chopra, to give you the lowdown on the condition and its treatments.
Acne is a inflammatory condition of the oil-producing glands called the sebaceous glands. Initially what happens is you get blockage of the sebaceous glands, which is the first step in creating the acne spot. And when you get blockage of the oil-producing gland, those are called comedones. And so what happens is when the oil-producing glands block, you continue producing the oil. And so you get a big bag of oil under the skin, which protrudes up into the skin. Now, there's nothing bacteria like more than oil sitting around doing nothing and not draining. So you then get an infection with bacteria of this oil, and that's when you get the redness progressing from the comedone, and of course you get the pustules, the yellow fluid that you find. Unfortunately, sometimes these pustule cysts can be quite large and they can burst not on the surface of the skin but deep into the skin, and that's what leads to scarring, because the skin does not like pus being discharged into it. And that's one of the reasons why we tell people not to squeeze their spots, because you may think that a lot of the pus has actually come out on the surface of the skin, but a lot of that pus you're squeezing is going to go deep in the skin, and that's what causes the scarring. We simply look at the skin and look for the features of acne in order to diagnose it. And we look for blocked oil-producing glands called comedones. If those blocked oil-producing glands are infected, then you get red bumps on your skin. And if, as the infection progresses, then you get pustules. So if you find pustules, red nodules, and blocked pores, that helps you make the diagnosis of acne. The effect of food on acne is controversial. Some dermatologists believe that if you eat foods that cause high levels of a hormone called insulin to be released, that this causes acne. Now, we know some patients with polycystic ovary syndrome have very high insulin levels. They have what we call insulin resistance, and of course with polycystic ovary syndrome, acne is a very common symptom of this condition. And therefore eating foods like chocolates, biscuits or processed carbohydrates will release insulin, and it is hypothesized that it's this high insulin that is responsible for causing acne. Now, do I believe that canned food cause acne? Now, the main evidence I have personally as to sweet food causing acne is my patients themselves. Several patients will tell me that if they have chocolate the next day or the day after that, that they get their acne breakout. So I actually do believe that having a diet which is rich in sugars, I do believe it has an impact on acne, but not everyone believes that. And of course, it's very healthy staying off sugary foods anyway. Using makeup in acne has to be given considerable thought. You have to make sure that the makeup you're using is not oil-based, and it has to be completely oil-free. There are a lot of makeup brands on the market which are mineral-based, and I would suggest that if one is to use a foundation, that foundation is a mineral-based foundation rather than an oil-based foundation. Now, when it comes to acne, make sure you do see a doctor or a dermatologist in order to diagnose your acne, because not all red bumps on the face are acne, and you have to make sure that you get an accurate diagnosis in order to get accurate and safe treatment for your acne. The treatment of acne, for mild acne, we stick to topical treatments, which often involves an antiseptic wash and using topical treatments such as benzoyl peroxide. Benzoyl peroxide can be bought over the counter in any pharmacy, but by prescription. by a doctor, use topical antibiotics, so things that apply to the skin, such as topical erythromycin or another medication called clindamycin. If the acne is moderately severe, we then use oral medications, and the choice of oral medications are antibiotics, and in women can be the oral contraceptive pill or a drug called spironolactone. Spironolactone opposes the effect of the male hormone, and in some women it's the male hormone which is one of the major causes of the acne, and if you block the effects of the male hormone in certain women, that treats the acne very well. Now, if you have severe acne, we reserve a medication called isotretinoin for it, which is a very powerful drug, very effective in the treatment of acne. It does have side effects. Most people will get dry lips and dry skin, which is the main side effect. You also have to make sure that you're on adequate contraception before you go on isotretinoin.